notable restriction I see in people trying to obtain the one-arm band is either a lack of practice in lateral tilts or their shy execution of them. But before we go any further, we must understand the function of lateral tilting. When beginning one-arm balance, your hands and shoulders must adapt to corrections in many new pathways, but undoubtedly the most troublesome is the lateral corrections. By learning to tilt the pelvis laterally in a straddle handstand, we can use our legs as counter levers to correct balancing errors. Similar procedure to the tightrope walkers. People often subscribe to one of two schools of thought. The first considering tilting to actually be a mistake, which is technically true. However, tilts offer us a safety net for when errors inevitably occur, and it's near impossible for adult practitioners to immediately develop the sensitivity required within the hand and shoulder without having access to this set of training wheels. And the other misconception is depth is best, with no regards to how the spine actually needs to articulate the pelvis. When fixated on a low target, the pattern here will not help you save your one arm. A swing of the pelvis represents a swing of the center of mass, which will effectively pull you off your base of support when using it in a practical sense, dubbing it almost completely useless as it destroys the very thing it swore to protect. Instead, focus on keeping the center of mass localized while maximizing lateral flexion. It could almost be thought of as a lateral Jefferson curl leading from the tailbone, aiming for minimal weight shift. This technique ensures the pelvis aligns inside the rib cage, reducing restrictions, keeping the center of mass for the better part localized, and saving you a lot of energy. Check this by filming from the ribs to the hands. Forming the movement well, you should see no notable movement. So remember, tilting the pelvis and swinging the hips are two very different things with two very different outcomes.